welcome back to Simply Women's Health with CJ. Today we're going to talk about tobacco use specifically during pregnancy. We've known for a long time, since the 1960s, that tobacco use was harmful. There have been warning labels ever since 1965 advising you of the dangers associated with smoking. As far as women in their childbearing years, if you are trying to get pregnant and you are a smoker, you decrease the chances of becoming pregnant. And if you do become pregnant, you are at increased risk to have an ectopic or a tubal pregnancy. Women who smoke have a higher rate of miscarriage in early pregnancy. You increase your risk for birth defects such as cleft lips or palates. You can also have babies that are born prematurely. You can have babies that are born smaller than they should be. Your placenta might not grow in the proper place, all kinds of risks associated during pregnancy. After you have a baby, if you are a smoker, you increase your child's risk for developing sudden infant death syndrome. Your child can have asthma. They may grow up and have a higher risk of becoming diabetic. They may also exhibit behavioral issues. So lots and lots of problems associated with pregnancy, especially in women in their childbearing years. So a lot of patients have elected rather than smoking. Now, cigarettes contain over 5,000 different chemicals. 60 of those are known to cause cancer. So a lot of patients are coming to me and saying, I'm not smoking anymore. I've switched to alternative uses such as vaping or hookah or chewing tobacco. Those are all some things that women are opting to do. Those products frequently contain nicotine, and nicotine, again, as we know, is harmful to you and your baby. So what about non-nicotine products, those that say they have zero nicotine? They too contain chemicals. Now, again, the aerosolized products, they don't contain the same chemicals that cigarettes do, but they contain different chemicals. And whenever you take a chemical and you turn it into a steam or a vapor, you change the chemical compound. And for some of those, that makes those chemicals a lot more dangerous. In medicine, if you are in respiratory distress and you go to the emergency room, they are going to give you a nebulizer treatment where they take medication, they turn it into vapor, and they give it to you via mouth because your body absorbs that medication much faster and it's much stronger than to try to give something, say, via a pill or an IV. So it's not any different with vaping products. They contain chemicals, and when you vaporize them, you change the chemical compound, and again, some of those can be every bit as harmful as using cigarette products. So here's the good news. Typically, when a woman finds out that she is pregnant, 54% report cessation at positive pregnancy test. In other words, they have stopped using all tobacco products. Approximately 7% of women are reporting e-cigarettes or vaping use during pregnancy. The recommendation is that you not use any of these products. Again, we do not know what the long-term effects of these are, but we do know that they have the potential to cause harm. If you are currently smoking and you wish to stop, there is lots of programs available. I recommend you talk to your healthcare provider to see what programs are available in your area. If you want to get started today, call 1-800-QUIT-NOW. If those are not working for you, I do recommend, again, keeping a good dialogue with your provider and seeing if there are some medications that can help. At the end of the day, it's a tough thing to do, but I wish you the best of luck. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your service.